Sort of like the old days of broadcasting.
Yeah, exactly. Okay, Mayor, we're good to go.
Thank you, Steve. Well, welcome everybody to our 18th edition of the Virtual Mayor's Breakfast. Today, we are going to be focusing on primarily three areas. We'll be getting an update from our wonderful County Supervisor, Candace Andersen, who will give us an update on the latest COVID news and both how things are opening up and the ground rules that are evolving before us. Our second part will be our wonderful elections director, clerk, Debi Cooper, who is going to be talking about the who, what, wow, all the stuff about elections and making sure that you're registered to vote and what the process is going to look like, along with Steve Spedowfski, who will actually go first. And he'll talk about the election process in San Ramon and how it's evolved because of the new state laws that have required cities who get challenged to go to district elections. He'll lay that part out. And then we will finish with Dr. Joseph, as he has done for almost all of our broadcasts, and give us the latest news on COVID and what's occurring in that world. And I always turn to our city manager, Joe Gorton, to give any updates about the city, any news he'd like to share with the residents before we start.
Thank you, Mr. Mayor, and good morning. Not many updates. City continues to navigate through the pandemic. Our programs are running successfully, both after school programs as well as some of our childcare programs are running well, given the state of where we're at with the pandemic. We, along with everyone else, are waiting to change tiers so that we can move forward in that direction. Currently purple. I think Candace is going to probably comment on that, right, as usual.
I sure am. I am.
So I will defer that to Supervisor Andersen, and I will be around for questions should anybody have some at the end of the broadcast.
And Joe, I would like to compliment our parks and community services and our senior citizen staff in particular for the work they're doing with our seniors. I saw a posting on social media the other day showing all their containers as they're making deliveries to about 450 of our senior citizens, bringing them enough meals for 5 days. They do this once every week, or I think they do it twice a week and make these different deliveries. So again, the residents, I've heard from them and to say thank you for taking care of our most vulnerable. Thank you, Joe.
On a side note, along a kind of a nice story to go with that is a local resident who's artistic painted some very, very cool rocks. And those rocks were delivered to our seniors as well as kind of to uplift their spirits. And it's been very, very popular. So that was a neat thing to happen as well.
I'm actually seeing those rocks around our local parks. So who's ever doing those, thank you. I know people enjoy seeing those little moments of brightness around. Supervisor Andersen, thank you again for being here in the morning. I know you have a busy schedule. How are things evolving here in the county? How does it going to affect our businesses and our families and our schools?
Well, the big question was brought up by Joe is, when are we going to change tiers? And so we just narrowly missed a week ago. So when you go to our website and you go to the state website lags about 10 days behind. We lag about 7 days, but when you go into our dashboard, you can see in this sort of gray area, but if you hover your mouse, your cursor over it, you can see what we're doing. So right now, live, we are moving, we've got the statistics we need so that we can move into the red tier. We need to do it for 2 full weeks before the state will move us into the red tier. And so the criterion for that is that we need to have at least under 7 cases per 100,000 for a 7-day average. And then we also have to have positive cases being between 5 and 8%. And for the last month, our positive cases have been below that. We're doing great with that. And we're averaging about 4.1% case positives. And then when you look at what we've been doing, we just missed 7.1% a week ago. We were at 7.1. Now we're below 7% ever since the 10th. We've been below 7%. So we're hopeful that that trend will continue. Now, one other factor that goes into the formula is how many people are being tested. And if we're not testing enough people, that could ding us and could require us to have more people or even fewer people per 100,000. If we do more testing, it helps us. And not just for that reason, but we still are encouraging people to get tested. It's really, really important. If you haven't been tested for 30 days, consider going onto our website and getting tested again. We also encourage you to go to your own providers. And it's a little bit of a dispute we're having right now with some of our healthcare providers because they're making it really difficult in some cases for their members to get tested. And so some of our larger healthcare providers are saying, you know, unless you're manifesting symptoms, unless you have a doctor's order, we're not going to test you. The county, on the other hand, really wants everyone tested more often than not for surveillance purposes, just to keep our community safe. So we're working through that issue with some of our healthcare providers. So some of the things I thought would be helpful too, you know, people are still wondering, well, why is the state allowing certain businesses rather than others? You know, it really comes down to the risk of spreading the disease. And so with businesses, it's looking at, you know, can they accommodate someone wearing a mask at all times? Eating and drinking, you know, requires removal of mask. Certain personal care services, you know, how can you allow physical distancing of people from different households? How can you limit the number of people per square foot? Limit the time that someone's inside for an activity? How do you increase airflow? You know, opening up the doors, opening windows, and then limiting activities that are known to increase virus spread, like singing, shouting, heavy breathing. And so those are some of the factors the state is relying on. So if we get to the red tier, and really the soonest we could get to the red tier is September 29th. It's updated every week by the state on Tuesday. That's when we get our designation. If, you know, looking at how we've done this past week, how we're doing next week, it's possible we could be moved into the red tier right on Tuesday the 29th. If not, it would be the first week of October, assuming, again, our numbers stay what they are. So some of the things that would be open once we get into the red is theaters can open at 25% capacity. Gyms can have indoor activities at 10% capacity. Right now, of course, gyms are allowed to operate outdoors. Museums could open at 25% capacity. Personal services, some will be allowed back indoors. Of course, hair salons are open indoors, but things like nail salons, other services, restaurants could go indoor at 25%, and not too soon as we start heading close to the rainy season. In-person schools, could begin, and our school district, great kudos to the school board of the San Ramon Valley Unified School District. They had a marathon meeting on Tuesday, and we yesterday had a great meeting with the COVID ad hoc meeting with Lynn Mackey, who is our superintendent of schools for Contra, Costa County, talking about some of the challenges, some of the ways schools can safely open. Now, I will say, and this has been the experience of my peers on the school board too, people are very divided. Parents are. There are some parents who just want their kids back in school in person as quickly as possible. You have other parents who are very, very concerned about safety. And I know that our schools are being very cognizant of both of those extremes, and then those in the middle who just say, let them back in as safely and as quickly as we can. Indoor religious services will be allowed once we're in the red zone for up to 25% of the capacity of the building, or up to 100, whichever is smaller. And again, there are social distancing requirements. You're not supposed to be singing. You're not supposed to be shouting, you know, for these places of worship. So very, very challenging. things, but nevertheless, great hope as we can move into this red tier. And we're very, very optimistic just looking at the trends. We'll add that it's, COVID is still here in San Ramon. In the last 14 days, you've seen 24 new cases in San Ramon. You now have had a total of 315 cases just in the city of San Ramon, which equates to about 379 per 100,000 because your population, of course, is just under 100,000. In contrast, your neighbors to the north, Danville, in the last 2 weeks, they saw 27 cases. So 3 more cases than you in the last 2 weeks. They've had a total of 271, but given that their population is closer to 43,000, almost half of yours, they are averaging 617 per cases per 100,000, as opposed to your 379. Alamo is also, they're in even of a little bit more, I would say, serious state, but they have more cases per 100,000 as well. They've seen 7 cases in the last 2 weeks, brings their total to 98, but because of their smaller population, they are seeing 664 cases per 100,000. Hospitalizations are down. We have capacity right now. We're feeling very, very good about it. Deaths, sadly, we're very close to 200 countywide. We're at 198 countywide. Of that, since the beginning of COVID, 110 were in long-term care facilities, which now makes up 55% of all deaths were in long-term care facilities. However, in the last 30 days, where we've had 44 deaths, almost a quarter of our deaths have been in the last 30 days, we've had 31 of those be community deaths, which made up 70% of the deaths. 13 were in long-term care facilities. So this is a trend I've been mentioning the last few weeks, that more and more of those who are passing away are not affiliated with a long-term care facility, but people just general in the community. We are getting concerned about a double surge of flu and COVID. The symptoms are very, very similar. We don't want to see hospitals overwhelmed because of the flu and or COVID. So we are encouraging everyone to get your flu shots. The county will be starting in October, be doing some widespread sort of mass opportunities for vaccination. This also sort of gears us up when hopefully we'll have a COVID vaccine as well. I'm encouraging you to work with your own providers as well, healthcare providers, to get your vaccine. And of course, many of our drugstores and pharmacies, grocery stores that have pharmacies are offering flu shots already. And I know there's some discussion about the efficacy of when's the best time to get it. Our health officers are saying October, but if you want to get it sooner, I think that'll get you through some of the worst of the flu season. We are at some of our test sites also going to be offering flu shots when we get into October. Halloween, we're not banning it. We're not saying you can't enjoy Halloween, but we're really offering guidance on the county's website to do it safely. Show your spirit by dressing up, by decorating, by doing drive-throughs of neighborhoods where you can see fun Halloween displays. It's really, really hard to maintain proper social distancing on porches, on front doors, when people are all touching the same doorbell, grabbing out of the same candy bowl. Yes, we're learning that the virus is not lingering on hard surfaces as much as we thought it was early on, but nevertheless, it is a concern, and trying to avoid having group large parties outside of your household or your other sphere of regular people you're engaging with. Again, when masks are off, when you're in close contact, especially indoors, as we often are in October, it could be an unfortunate breeding ground for this infection. Schools. As I mentioned, we had a great meeting yesterday. You can go on to the Board of Supervisors meeting agendas and you click on the COVID ad hoc meeting of the 17th of September, and you can watch the video of that. It was streamed as well as recorded via video, and you can hear more about Lynn Mackey talking about the challenges of schools, what she thinks is working, as well as our health officer discussing that. So we're really looking forward to it. Once we're in the red tier, and we're in the red tier for 2 weeks, then that's when schools can start implementing their plans for in-person education. And I know that our school district, again, has worked very, very hard on that as well. We still are approving waivers because we're still in the purple, and we've had about 20 schools who have had waivers approved, passed on to the state. Admittedly, most of these are for private schools, just because the rules, requirements are much easier for them to comply with because they do have funding from the parents. Big news with homeless services. We were given a grant to purchase a Motel 6 in Pittsburgh. It's one we've been leasing to house our homeless. And one of the main goals we're having post-COVID is to continue to provide supportive services to our homeless population and house them where possible. So this was great news that we were awarded this Project Home Key grant. We've been using Project Room Keys grants to provide these services to the homeless, but this will be one more way to really enhance what we can do for our homeless population, looking at other opportunities. So end of my report for this morning, and happy to answer any questions anyone has at the end.
Thank you. Thank you very much, Candace. Good update. Now we're going to talk about the upcoming elections in November and both how they're structured and why, and Steve will be doing that. And then to make sure that you were able to cast your ballot, Debbie Cooper will come on and give us the details. So Steve, you're up.
Great, thank you, Mayor. And thanks for the opportunity for presenting this morning. The city's been really pushing the change to district elections over our information channels for the last week or so, preparing everybody for this change, because it is a significant change to the way that most of the residents are going to vote this year, and I'll go into that. But I'm going to start by sharing a bunch of screens this morning, and I know I've shared this one on occasion. It's our district elections implementation screen. And I'm going to try to summarize about 6 months of work here in under 5 or 10 minutes, because I know we're short for time in the morning. But if you go to this page, and you can get here by either going to the city clerk's page or even just typing in San Ramon district elections. It's one of the first pop-ups on Google. So at the bottom, we have basically the history of why district elections. And to summarize it, in 2004, the city of Modesto was sued for violating the California Voting Rights Act. And the Voting Rights Act prohibits the use of any election system that, quote, impairs the ability of a protected class to elect candidates of its choice or its ability to influence the outcome of an election. So basically, any city that holds their elections via an at-large election system like San Ramon did prior to this is at risk of being sued. And that's approximately 482 cities in the state of California. And also special districts, as I'll go into a little bit later, are subject to this as well. And there's about 3,400 special districts. So this is a change that is sweeping California. And as a result of the initial lawsuits and the amounts that cities were spending on the lawsuits, AB 350 was adopted to amend the California Elections Code, which basically provides a structure to the process. So cities and jurisdictions have a certain amount of time to decide whether or not they will go to district elections. And then once the decision is made, they have a certain amount of time to conduct all of the public hearings and go through the public process of forming district elections. And so in some of the early cases, the cities who did contest the letters from the attorneys didn't have a lot of success in preventing the formation of district elections. And that usually resulted in paying millions of dollars worth of attorney's fees and legal fees. And in some cases, the cities are not the ones who are the determiners of the district boundaries. That would be determined by the judges and the lawyers. And so you lose a bit of local control as to how your boundaries are drawn. So the vast majority of cities, when faced with this, decide to retain local control, do the process themselves, and come up with the best possible results for their residents. So in November, or I'm sorry, in 2018, the city received a letter from a local attorney that began the process for San Ramon. So as you scroll up on this page, it's kind of a reverse scroll of how things were, with the most recent information up top and how things were formed on the bottom. So you can see here, we have all of our public meetings that we held and our public hearings forming the district elections. And we also have all of the data that was used, because you do have to hire a demographer. They cannot be arbitrarily drawn. A demographer is needed to make sure that you have not only as equal population as possible for each district, but also that you're not missing any kind of communities of interests or splitting things awkwardly or basically gerrymandering districts for whatever reason. So here we have all of the background continued. The public participated in this, and you can click on each one of these links to see the different public maps. Our different rounds of going through district maps. If I recall correctly, we had around 9 versions of the district maps that the council considered. And then we had the actual implementation documentation here. And so what we did as a result is we created another site. If you go to the city clerk site, it's just above the district election implementation. It's a site that gives you basic district elections information. So we're trying to distill that 6 months of work down into some bullet points, a 1-minute video, and a map to look up what district you live in. And Mayor, if you like, I'll play the video. Let me just switch over to that. And here we go.
The next election for San Ramon City Council seats will be held on November 3rd, 2020, and this year, the process will be different. In previous years, the City of San Ramon held at-large elections, in which registered voters elected the mayor and 2 city council members every 2 years. In 2019, the city switched to a district-based election system. The mayoral seat remains at large, while council seats are elected by district. On November 3rd, 2020, all registered voters may cast their vote for a mayoral candidate to serve a 2-year term. Registered voters who live in Districts 1 and 3 may vote for 1 city council member to represent their district for 4 years. Registered voters who live in Districts 2 and 4 will vote for representatives for their districts in November 2022. To find out which district you live in, visit sanramon.ca.gov/findyourdistrict or contact the city clerk's office at 925-973-2539.
So if you do go to that link, the district elections, you will get this page and this map here. Actually, I have it preloaded in this tab, and it will show the districts that were adopted by the city council. And what you can do is you can either zoom in, or in the upper right, I think my Zoom picture is probably blocking that. You could type in your address and you can see where the district lines are and what district you will be voting in this year. If you click each one, you will see which council member, and it has a link to their bio, serves in what district. So this year we have districts 3 and districts 1 are up for election. And what's going to be also an additional change for residents is that 2 other elections in our area have moved over to district elections. So the first that I'll go over briefly is the Dublin San Ramon Services District, and we'll put the links in the YouTube video to each one of their information pages. And DSRSD also has a map for their district elections. Let me get to that here. There we go. And you can see that they have their district, their Division 3 and also their Division 1 will be going up for election this year. And then also the school district. And again, we'll have that link as well. And they provide a great summary with links to all the documents. We'll be going to district elections this year as well. And I believe their districts up this year on their map is Districts 2 and Districts 3. So if you were to overlay all 3 of the city, the DSRSD, and the school districts onto one map, there is a portion of San Ramon here. So here is 680 and Crow Canyon. So the southwestern portion of San Ramon will only be voting for mayor this year. So that's essentially the majority of District 2. They will not be seeing a DSRSD candidate, and also they won't be seeing any school district candidates. And normally residents prior to district elections would see mayor, 2 council members, 2 or 3 DSRSD representatives, and 2 or 3 school board members. But this year it will be different. So we are in the process of reaching out to residents about this change. Again, it's a pretty significant change in the way that you vote. We've pushed this out during the month of September on all of our social media channels. We've had it in several of the city newsletters that has gone out to residents. And we recently mailed to every residence in San Ramon a small postcard with the information as well. So with that, Mayor, I'll wait for questions. I guess I'll self-manage my own questions at the end of the Mayor's Breakfast.
Thank you, Steve. Thank you for instilling in only about 10 minutes a very complex subject that we spent a long time having to go through. And editorially, I think it was pretty clear from the council and for most residents, we did not want to proceed down this road. But because of this state law and because we were actually sued by an outside party, and because the downside of losing any challenge to it is extremely punitive, that we made, we took the discretion of going that direction as opposed to the substantial penalty if we had not prevailed. So.
And Mayor,
No.
some cities have voted on it, and the residents turn down the vote and they get sued anyway. So they go through a vote and then they get sued for millions of dollars. So
Millions of dollars. It's a lousy situation. Debi Cooper, you are a county clerk-recorder, and help us understand clearly how we can assure that we can vote.
Well, thank you for having me, Mayor Clarkson. Welcome, everyone. I'm Debi Cooper. I'm the Contra, Costa Clerk-Recorder and Registrar of Voters. And this is going to be a historical election. Besides just the politics of it all, the COVID pandemic, PSPS power shutoffs or brownouts and wildfires, we're expecting record turnout. We already have 670,000 registered voters. It's gone up about 30,000 in the last few weeks. And we are expecting to get very close to 700,000 voters, which is a record for us. So I have a short PowerPoint to show you with our, to help show you our plans regarding the upcoming election. So I hope you can all see the screen. So voting during the 2020 pandemic. So this election in November there's a lot of things that are changing and a lot of processes we're putting in place, but for the vast majority of voters, they're not going to see anything different. Over 75% of the Contra Costa voters voted by mail in March. This is what they're used to doing. They're not going to see anything different, but it's going to be a new experience for the other 25%. Some of this has to do, there's been an executive order by the governor of California and then some legislation that requires us to mail a vote by mail ballot to every single registered voter in Contra Costa. What is going to be different is if you choose not to vote by mail and you choose to go to one of our in-person sites, you're going to be faced with social distancing and safety protocols that have not been in place before. Lines are going to seem longer. We're calling it the Trader Joe's effect. Because if you go to Trader Joe's, everyone has had that experience. The line may wrap partway around the building, but in reality, there's only 10 or 12 people in line. So things are going to be similar to that. We're going to be restricting the number of people in our polling places for both the voters' safety and for our staff and our volunteers. We're also expanding our programs for ballot return and in-person voting. We're hoping we give so many opportunities that everyone votes by mail and no one shows up to our in-person sites except for those few people that need in-person services. So we have added 25 more secure ballot drop boxes. We had 12 in March. We're going to have 37 available that are available 24 hours a day and 7 days a week. We're going to have 17 early voting sites. We had 3 in March. And these are sites that are going to be available for 4 days before election. The Friday, Saturday, Monday, and election day. And those are all in-person sites that have the ability to provide services for anyone in the county. So you can go to any one of those. 11 of those are going to be tents located outside in large parking areas where COVID is going to be, you're going to be protected more in those areas because there's going to be more of an outside fresh air atmosphere. We also are going to have generators at those. So if something really horrible happens and we end up with power shutoffs, we're going to have some places available for voting for those 4 days with power by generator. So the part of the legislation allowed an additional 17 days. So ballots that are postmarked by election day, we have until November 20th to receive them. There's some concern about the postal services. We don't share those concerns. We meet with post office staff every Friday, and they are our partners in this. They're also used to dealing with large amounts of mail. If you think about, it's not just our ballots, think of how many mailings you get from candidates and or measures and things like that. So first class postage is prepaid for the first time. No one has to worry about how many stamps go in an envelope. So we're taking care of all of that for you. You just drop it either in the mailbox or in one of our drop boxes, and we'll make it back to us just fine. All ballots will include an I voted sticker. There's a little picture of it in our 3 languages. Many people go to the polls and drop off their ballot simply to get this sticker. So by including it with every single vote by mail ballot, we're hoping that voters will find other ways to return the ballot besides going to a polling place. And then just want a caveat that vote by mail ballots do take more time to process. So when we have the majority of our people that are voting at the precincts, those ballots get counted at the precincts in our equipment. If everything comes back as vote by mail, we have to, check the signature and then open them all, and then we're going to be counting those later. So we're hoping that vote by mail voters send their ballots in early so we can start getting those ready to count in advance. So our secure ballot drop boxes, we moved from 12 to 37. This is what they look like. They're high security design. They are bolted down to the concrete in locations, and they're serviced every day by 2 election staff. So we're emptying those every single day. Because there's so many of them, the list of locations is on our website, cocovote.us, and in the voter information guide that every voter is going to receive. Those voter information guides are going out a week from today on September 24th. So this is just a schematic of where all the drop boxes are. There are 2 in San Ramon, and the locations will be popping up later. So our early voting locations, this is just a schematic picture of what they're 20 by 40 tents that are enclosed. They've got an entrance and an exit. All of our COVID protocols can be followed. They're going to be open for 4 days, Friday, Saturday, Monday, and E-Day. 11 of them are in these tents. The other ones are in inside locations. And then we can provide all services there. We purchased electronic poll books this last year, which is a great technology for us. And what that allows us to do is have a copy of every single voter's registration information in the county. It's going to reduce the number of provisional ballots dramatically because we'll be able to issue people the correct ballot on site. And these are the locations of the 17 early voting locations. They're spread throughout the county. And we really tried to find locations where people prefer to vote in person. So we're targeting those folks. So on election day, we are also going to have our polling places. We're hoping no one shows up because they all voted by mail, but there is going to be a place for every person to go if they choose to vote in person. We are going to require personal protective equipment, which means masks, and social distancing protocols will be in place. We've mocked up an election, a draft polling place, and public health personnel and risk management personnel have signed off on it that we're meeting all the social distancing protocols. We will be keeping voters outside and limiting the number inside the facility so that our staff and the volunteers and the voters stay safe. We'll be cleaning the equipment between every voter. Our protocols are very stringent, but we think it keeps everybody safe. And the Trader Joe's effect, so there could and will be lines. We just are letting everyone know that, but they're going to move fast because people will be spread apart. And then this electronic check-in with these electronic poll books is going to eliminate most of our provisional ballots. which speeds up our processing of our final counts for the election. So here's the important dates. September 24th, next Friday, voter information guides are mailed to every voter. And this will have the locations of every ballot drop box and early voting site. I want to also add, the state sends out their voter information guide. I got mine yesterday. So every household gets a state voter information guide. In Contra Costa, every voter gets a Contra Costa voter information guide. And it does seem like it's a lot of paper and things like that. But for some elections, we may have people in the same household that have different political parties or something, and they actually may have a different ballot. So everyone gets their own sample ballot in their voter information guide. And then October 5th or before, our ballots are going to be mailed to all voters. And that's all voters that are registered as of September 9th. That was the cutoff for the data. Anyone that registered after September 9th will still be getting their ballot, but it's probably not going to be mailed out on October 5th. It'll be on a subsequent mailing. And then on October 5th, we start in-person voting here in Martinez, and we unlock all those secure ballot drop boxes so people can start putting their ballots in them. Then we're asking voters that if on October 19th, you haven't received your ballot, that you contact us either at this email address or our phone number, because we want to find out why you didn't get your ballot and get you issued another one. Could be your address was wrong or something like that. And then October 30th is when our 17 early voting sites open, and they'll be open for 4 days. And then of course, November 3rd is election day and the day that all ballots must be postmarked. They can be received by our office up to 17 days after election day, but they have to be postmarked by November 3rd. And so November 20th is the last day for us to receive those postmarks. So we want every vote to count, and we want everybody to do their part to be ready to vote. So we've included our website for people to check their registration, or they can register and be sure their mailing address is correct, because that's where their ballot is going to be mailed. And then we want everyone to vote by mail. Please vote the ballot we send you. We will have many places for people to vote to hopefully spread out the number of people in those locations, but we want to keep those locations for services that are required. You know, someone loses their ballot and it's very close to election day, or they need to do conditional voter registration because they've moved recently, or they have special language or ADA needs. And then a brand new program is Where's My Ballot, which is through the Secretary of State, and that is with the US Post Office. You can see when the post office mails it, when it's delivered, and it's kind of a cool program. And then of course, we have always had a process where you can sign into our website and see what the disposition is of your ballot. You can see when we receive it, when it's counted. If for some reason it wasn't counted, why? But that's very rare. And then I'm not going to go through these, but these are all of our online access to our different social media. And then here's the San Ramon drop boxes and early voting sites. So you have 3 drop boxes, 2 are 24/7, and 1 is available during business hours at the City Hall. And then the San Ramon Community Center is going to be one of our early voting locations. And we really appreciate the city being a partner in this. It really helps us all. And that's it. Our main message: stay safe, vote by mail, spread the word. You know, every vote is important, and we're doing all that we can do to make sure that voters are ready and able to vote. Don't let COVID keep you from voting. We have many ways that you can vote and still stay safe. And you can be confident that the Contra Costa Elections Department is handling your ballot appropriately and safely. We've been doing this a long time. We've been doing a lot of vote by mail for a long time. And the one other thing is, we would like, if you're looking for information about this election, that you go to the source. You go to the city of San Ramon, you go to Contra Costa, you go to the Secretary of State for California. Some of the national voter sites have information that appears in that it's wrong, but it's because they're trying to address issues nationwide, and every state has different laws. So go to the source so you get the information that's appropriate to your location. That's it.
Debbie, thank you very much. I want to comment that in the 22 years I've been involved in public office, I have found the Contra Costa Elections Office to be thoroughly professional and well organized. You guys are role models for the rest of the state. And it complements to the work you guys have done and continue to do in tough times. So thank you so much. I want to remind the audience, by the way, you may have questions for our county supervisor or about elections and our next speaker, Dr. Joseph, and address them to info@sanramon.ca.gov. And Steve will take those questions and organize them and ask. It's now my pleasure to introduce again to the group, Dr. Joseph. Tell me, sir, what's gone on these last 2 weeks and what can you share with us?
Well, I've picked a couple of topics to discuss today, mostly based on the questions that I'm getting frequently. I will, as usual, share the screen. And we should be on board. The things we're going to discuss today are two common questions. Is it safe to fly? And then the term twindemic that's going to be coming up in a few months. And that is when COVID and influenza are both circulating in our community. Then maybe a couple of quick topics at the end. So is it safe to fly? As always, when we use the term, is it safe, followed by anything, there's two major considerations. That is, what is the risk of getting an infection, COVID, and what are the consequences if one does get infected? Now, the risk always is determined by the background rate, and that was addressed a little bit earlier by Supervisor Andersen in our community. But it has to do with the background rate where you're flying from and to. That is the number of new cases. If we are talking about flying from a hot spot in the United States, the risk is going to be much greater that there would be someone on the plane who has an active infection. If we're talking about areas of the country where the background rate or the number of new cases per 100,000 is low, then the risk is going to be much less that there will be an infected person on the plane. Closeness to others, remember, as we have said so many times, this by and large is a person-to-person disease. And an airplane is a very confined area. And I'm going to compare that in a little bit about being close to others in your own living room as opposed to being close to others in an airplane, because there are major differences that we're going to have to discuss. But the closeness to another person is also a very important part of the risk. Masks must be worn. I don't know if all airlines require masks, but masks should be worn on every airplane by every person. They not only protect others from an infected person, but they also protect you from getting it. The major effect of a mask is to trap the virus from a person who is breathing the virus out. That is, the major effect of a mask is to trap a virus from a person who is infected. But there are also benefits to protect those of us who are not infected. By wearing a good mask, it reduces the likelihood of getting the infection. And airplane air handling is a very big topic. We're going to address that a little bit. So that's the risk. What's the risk of getting an infection on a plane? And then the consequences. If an individual gets an infection, what are the consequences to that person based on their age, medical condition, risk factors for a complicated disease as opposed to an uncomplicated disease? Also under the consequence list is, if I get infected, who might I transmit that to? That is, there someone in my family or my close contact who is immunosuppressed, who is taking medications that affect their immune system, or do they have risks of complicated disease? And then the last component of the consequence is, if I were to be infected, what is the disability to me? If I'm the provider for my household and I can't work, that's very important. On the other hand, if I'm not a provider, would the disability, that is the 2 weeks that I can't work, the 2 weeks that I have to be on home isolation, how will that affect? So this is for an individual. Everyone needs to look at this with their own background, their own social situation. What is the risk? What is the consequence? Now, modern airplane handling is absolutely amazing. When smokers were permitted on airlines, they made major changes to the air handling system in the passenger compartment of the plane. The passenger compartment, by the way, has a completely different air handling system from the cockpit, and the cockpit is even better. But in the passenger component, there is an air exchange every 3 minutes. That's 20 exchanges per hour. That actually is more than what we have in a modern operating room in a hospital, where air exchanges are a very important part of protecting the individual having surgery. So this is fantastic. That is 20 exchanges per hour. And not only is it the number of exchanges, but air is passed through a HEPA filter. That's a high efficiency particulate air filter system. And that will capture most of the COVID viruses. So modern airplane handling is good. So what I've shown on the right is a typical seat map of a 737, which is a very common plane that one might take. And I have the individual there in row 9C as me. If I am sitting in row 9C, the risk to me is really the people around me, not the people in the front, not the people in the back, but the people that are in the row in front, the row behind, and next to me. That really is the closeness. When I talked about what is the risk of flying, it's the closeness of the people around me. I won't sit in 9C unless everybody in that circle is wearing a mask. And I won't sit in 9C if someone in that circle is coughing. That is how we protect ourselves. So is it safe to fly? You can see that it's pointing that direction, that with some common sense activities, it can be safe. So with modeling then, now this is for United States modeling, we actually have come up with some numbers of what is the likelihood of getting COVID on an airplane with the current background rate. And to use a background rate, we had to use the whole United States. It will be different for different areas based on the incidence or the number of new cases or the likelihood of somebody around me in 9C might be infected. But this is how it goes. If we figure a 2-hour domestic flight on a 737 and everybody is wearing a mask, the risk of getting COVID is 1 in 4,300 if you're sitting next to another person. Not another infected person, because we don't know if that person sitting next to me is infected. But the risk is 1 in 4,300. And if there's an empty seat between, and I think I got a flash this morning from one of the commercial airlines that they are still keeping the middle seats open, that the risk is much less. It's 1 in 7,700. So this is where the modeling comes out. It means that the risk is not zero. We are in a pandemic. There's no such thing as a zero risk, and the term safe really is subjective. But these are the modeling numbers that are out there. So with these numbers and what we've talked about at air handling, these are some common sense recommendations that I would suggest that you follow when they're possible. Longer flights have greater risks. If you have to fly internationally, if you have to fly cross country, then you have to do it. But remember, on longer flights, there will be people taking their masks off. There will be people eating and drinking. There will be close contact as people pass each other in the aisleway of the airplane. And there will be people using the bathroom, which represents a high touch area. So remember, high touch areas are areas where if I sneeze into my hand and I'm infected and I touch the bathroom door, that's infectious. So longer flights have greater risk. We have to accept it if it's mandatory that we take a longer flight. If you can, don't eat or drink on a short flight. Keep your mask on. Most of us can go a couple of hours without eating or drinking. Keep that mask on because it protects you and you want others to do the same. Carry something with you to disinfect high touch points. Now, many airlines are disinfecting between flights, but you want to disinfect a high touch point. You don't need to disinfect the seat because that's going to be where your butt is. You don't need to disinfect the back of the seat in front of you, but perhaps the armrest. You don't know if the person before you was infectious, sneezed, or coughed into his or her hand and touched that area. So disinfect high touch points, and certainly if you have to go to a bathroom. Common sense is to carry hand sanitizer. And remember, the reason you sanitize your hands is because you don't want this virus on your hands when you touch your face. And you will touch your face. I promise you, we all try not to, but you will. So hand sanitizer is important. Never take off that mask for the reasons we've discussed. I won't go around anyone who is not wearing a mask. I love airlines who make it mandatory. I know there's been some problems of insisting on wearing masks, but I favor the airlines making it mandatory. And then distance yourself from others. Boarding, sitting, offloading, common sense. What all of us used to do on an airplane is when the plane landed and the bell went off, we all stood up and we were all within 5 or 6 inches of each other. That is something that should not be done during this pandemic. Now, there's a comment that the window seat is probably better than the aisle. It has not been proven. It's a common sense thing. There's better air circulation near the window seat than the aisle, but probably more importantly, there's not people walking by you if they have to go to the bathroom or if they have to go up front. So these are sort of the common sense recommendations. We're seeing the air travel come back. These are things I think you should consider when possible if you have to fly. And the better answer, of course, is don't fly if you don't have to. Now, the next topic, the twindemic. We have an upcoming challenge that we have never seen in my lifetime in many decades of infectious diseases. COVID will be present when influenza hits. We're not going to have a treatment. We're not going to have a vaccine that is available when influenza hits us in California. So let's talk about some differences between the two so that you understand how we have to address this and how our level of awareness is going to need to increase when influenza is in our communities. Influenza is a seasonal virus infection. So far, COVID is not. Predictions that COVID was going to be seasonal have not yet panned out. So we should consider that COVID will be around at a continuing basis until we either get treatment or a vaccine. Influenza is going to be temporary. There's no reason to think that influenza will be different because of COVID. These are two completely different viruses. They're not related. Infection with one has nothing to do with infection of the other. A vaccine for one will be unrelated to the vaccine for the other. They are just two different infections. They're like a measles infection and chickenpox. They're just different, but they will be in our community at the same time. If one gets influenza or one gets COVID, they are not necessarily more susceptible to the one they don't have, and immunity from one does not infer immunity to the other. If one has recently had a COVID infection, it is likely that they are immune to COVID, but that has nothing to do with immunity to flu. If one gets a flu shot and has a very successful high titer or a good response to the flu vaccine, that has nothing to do with immunity to COVID. Two different viruses. Now, Supervisor Andersen said this. This is tough. It's very difficult to distinguish these two viral infections by symptoms. Yet it's critically important to know which one a person has. So if we move into December and January, where it's going to be colder, it's going to be raining, we're going to be indoors more frequently, the symptoms will be the same. But if a person gets sick with a fever and a cough, it's critically important to know whether it is influenza or COVID because we manage them completely different. The infectivity or the threat to household members is completely different. And what we advise individuals to do regarding self-isolation, quarantine is also completely different. So the bottom line is there. This is how we have to address this in our community and around the country and around the world. We need quick tests. If someone has symptoms that could be either, we need to have a test with quick results that will tell us if an individual has COVID, if an individual has influenza, or neither. And we will be there. I'm going to give you a voice of confidence that is a #1 goal of the United States Public Health Service. The testing will be available. We have it now. We can test for influenza in 15 minutes. We can test for COVID in 15 minutes. Currently, those quick tests, the good quick tests, are deployed to high-risk areas. They're being deployed to nursing homes. They're being deployed to hospital emergency rooms. They will be used by school nurses. They're going to be in special areas, but not by December. They will be available. And that is how we're going to address this twindemic. So I'm going to say this now, and probably it'll come up again in more of these meetings. If an individual has symptoms in the middle of the COVID influenza time, when they're both there, and it's going to be around December, get tested. You've got to know. You can't do what we did last year. I got the flu, I'm going to stay in bed for a week. That won't work this year. This is a major change. Testing to find out which virus one has is critical, both to protect your family, your household, and for your own management. So many questions come up about influenza vaccine. I am a strong proponent of the influenza vaccine, but let's talk a little bit about some of the problems with the influenza vaccine, just so we can keep it in perspective. Production is now done. We're not expecting a shortage of influenza vaccine, but remember, production started last year. Planning for production started last fall before the pandemic. So there are about 200 million doses available in the United States, and that in the past has always been enough. But it's still all we have. Now we have about 300 or a little over 300 million people in the United States. If there is a rush on getting influenza vaccine, we could have a problem. If influenza vaccine becomes more popular because of the pandemic, we could have a problem because this planning was done before the pandemic, before COVID hit us. So we have 200 million doses. What this means is when it's time to get a vaccine in California, and I'm going to address that, go get it. Don't wait. Don't wait to see what's going on because we don't want to run out of vaccine. Now, in 2020, so just so you understand how flu vaccine works and why it isn't a perfect vaccine. The vaccine for 2020 is based on what was present in 2019. We're always a year behind. We hope that we hit the target. This has been the model for decades. We don't have anything better. We can't predict what flu is going to be present in 2020, and we still don't know. We can't look at what's going on in Asia, what's going on in the Middle East, and predict what's going to happen in the United States. So we make our vaccine based on the strains that are present last year. And we're going to do the same thing this year. We will be monitoring influenza this year, and that will determine how we make the vaccine for 2021. Therefore, it's not perfect because we never hit the target right in the bullseye. We get some of it, some we miss. This is a quadrivalent vaccine this year, meaning there's 4 different strains in the influenza vaccine, 2 influenza A, 2 influenza B. And historically, because we don't hit the bullseye, it's about 40% effective, not in preventing flu. It's 100% effective or 90-some% effective in making antibodies, but we're making antibodies to strains that are not circulating. So historically, it's about 40% effective in preventing the virus that is circulating that year. So when flu hits us around December, we can assume that unless there's something unusual, we have about a 40% chance of being protected if we get a flu shot. So it's not perfect, but doggone it, it's a lot better than not getting a flu shot. So 40 for a vaccine that is unbelievably safe, to protect yourself or to have a good shot at protecting yourself, it's well worth it. Now, we have 11 different products that are going to be available, and your doctor will know that there are special formulas for persons over 65, those who are pregnant, those who are allergic to vaccine components, those who have allergy to eggs, those who have allergy to neomycin. So there is a flu shot for everyone, and your healthcare provider will know which one for you. And the recommendation hasn't changed this year. Everyone over 6 months old should get a flu shot. I'm aware of all of the controversy. You can see pretty clearly which side I'm on. Everyone over 6 months. Now, the last line is the one that I want to address next. This vaccine is not only 40% effective, it's not ideal, but it doesn't last very long. It only lasts about 4 to 5 months, which means if you get a flu shot in August, you're not going to be protected when we have our highest flu in the community. So we discourage getting a flu shot too early. And the next slide is going to show you what happens in California and how it compares to other places in the country. And that's here. What we're showing here is the line on the left. It represents 2018 and 2019, that we get flu in California starting in mid to late December, and it lasts to March. And what you're seeing on the right, if we take a look at that, you can see that that's not true in other parts of the country. California there is a light yellow, which means that's very low flu activity in the 3rd week of December of last year. But the red, look what's going on in the Southeast and in Texas and even in the Northwest. So the best way to determine when you get your flu shot is to follow the paper, follow the news, be prepared to get a shot as soon as influenza hits California. Typically, I say late October, November is a great time because that will cover us all the way through March. And then the last thing to say is that COVID and flu are different. On the left, you can see the mortality rate of influenza is very low for those over 65. But almost 20 times higher for COVID. COVID is a virus that is much worse. And anecdotally, I think I love this slide, the one on the right. Look what happened in San Diego. When COVID hit, it frightened us so much. Everybody was wearing masks and social distancing, and that also protects against the flu. So this is the peak time was January in San Diego. And when social distancing and masking started to become popular, influenza fell to almost zero. So perhaps we won't have a bad influenza this year because we still will be following the guidelines of the Public Health Service for social distancing and masking. And with that, I think I'll stop right here. But if there's any questions, I'll try to address them. Mr. Mayor, again, thank you so much for giving me the time. It's always a pleasure.
Thank you, Dr. Joseph. That was absolutely fascinating, especially for those who must travel on planes. It was reassuring to hear the statistics and the facts. And I appreciate that. And your comment about how the flu season collapsed last year once people began wearing masks and social distancing, which reinforces the point that every year going forward, we should wash our hands and be mindful of that. Would really help. But thank you. One quick question before we go to all the questions with Steve. Some folks, because the flu shot only lasts a certain period of time, they're thinking about getting it twice, once now and once in January. Does that make sense? And can you do it twice?
Yes, you can. So there's no side effect of getting the flu shot twice. So those who have to travel to areas where there's influenza right now, so if their business travels to Asia, or if they have to travel to the Northeast in October and perhaps flu will be hot, it's very reasonable to get 2 shots in one season. For when I was doing a lot of traveling and a lot of lecturing, I was in flu areas, and typically I got a flu shot on Labor Day and New Year's Eve. That was my mantra. Very safe to get it twice if it's indicated for a particular person.
But we don't want to.
I will caution you.
But we don't want to encourage that.
My only
because we
caution
have-
about saying this is that insurance companies may not cover it twice.
Right. Nor can everybody do it because you're limited to 200 million total doses. And so we want to make sure that you
Correct.
only do it if you're required.
I'm not making a global recommendation.
Thank you. I wanted to make that point. Steve, what do we have in terms of questions? What an utterly fascinating breakfast this morning.
Yeah, we have a lot of questions, and I'll state my disclaimer that I usually do. I'm trying to combine common questions all together. We received a lot of questions about where I can vote in terms of the early voting locations and the drop box locations, and Debbie did have that in her presentation. We also have it on the city's website under the city clerk's information, and we'll be sure to post that link in the YouTube comments as well for people to go to. One question for myself that somebody sent in was, how can they learn more about candidates for city council? Is the city hosting any events? And the city does not host candidate forums. The city stays out of the election process in terms of any kind of candidate forums or promotion of the election process, other than the candidates must register with the city clerk and they filed a statement with the city clerk, and that's about it. So if you want to learn about candidate forums, I encourage you to turn to your local chamber of commerce or any other maybe local news sources. Sometimes hold interviews or post articles. So you do need to go outside the city for that information.
The chamber is sponsoring a debate, I believe, next week. So you can go to the chamber website.
Well, and I want to throw in League of Women Voters doesn't choose candidates, but they do host a lot of wonderful forums, and they also have a lot of information on their website. So I'm going to make a plug for them.
Absolutely. And Debbie.
Yes, I was going to say, I'm just looking at our schedule because the League of Women Voters is working with us to host some, and it looks like the San Ramon mayor, they actually filmed it yesterday. So those will be posted on CCTV eventually. That's the only one I see for San Ramon. It wasn't every single race they did. They selected them from throughout the county, but the San Ramon mayor, 6 candidates, was filmed yesterday.
And also your pamphlet you put out will have a candidate statement from each of the candidates on their positions.
Yes, if they chose to include one, but most do.
Correct. Thank you.
All right, we have a question for our city manager. This year's National Night Out has been delayed to Tuesday, October 6th. What are the plans for San Ramon for the police and the fire district?
Well, the police and the fire district are both looking at that. Obviously, it's going to be driven by the health order and what we can and can't do. So as it gets closer, there may be a virtual event. There may be some sort of in-person event, depending on what the health order allows for. So I would just say stay tuned and check the police department's website out as the date gets closer, and there'll be more information on it.
Great. Next question is for Debbie, and it's a two-parter. Do you think there will be more participation by voters who usually don't vote, since they will be receiving a mail-in ballot? And are you concerned about mail fraud? And do you think that there will be less ballot harvesting during COVID-19, and you might need to define ballot harvesting?
Well, historically, vote by mail voters vote at a higher percentage than in-person voters. Part of that is because the ballot's in front of you and you don't have to, get in the car and drive to the polling place. So for that reason, and there are statistics that have shown that when agencies or areas or states go to all vote by mail, the turnout does increase. It's not huge because some people don't want to vote. You can't make them. And then, I'm sorry, what was the other question?
The other question was about
Harvesting.
mail fraud and harvesting.
We do not believe there is ballot harvesting in Contra Costa County, which is perhaps at a congregate care facility where someone might intercept the ballots and vote them and turn them in. We check every single signature against the signature we have on file. So it would be very difficult for something like that to happen.
Okay, and where do you get that signature on file? That was another question.
Well, it's from your original registration form, or if you register online, it's your DMV signature. We work in coordination with the Department of Motor Vehicles. So we tell people, because primarily now a lot of people have re-registered or registered online, is to look at their driver's license, and that's how they should sign their ballot. And it should be fine.
Great. For Dr. Joseph, there was a question about, we have a focus a lot on the number of cases and deaths. What do we know about long-term or permanent health effects from COVID-19? And you may have answered this many 10 mayor's breakfasts back, but if you can address that, that would be great.
Well, if I said the same thing then as I'm going to say now, it means that I've not been keeping up with it. This disease is a rocket ship, and it's changing every day. A quick answer is every week we are learning that the sickest people are having the longest symptoms after recovery. So being sick or not feeling well for 2 to 3 months now is common. That's the fatigue. More importantly, we are now seeing some individuals developing permanent damage. At least we think it's permanent. Remember, we're only into this for 9 months, particularly of the heart and of the brain. So the sickest people who are hospitalized are now showing evidence that there is heart dysfunction long after the disease has resolved and some neurologic dysfunction. What I can't tell you is that in 6 months, will that be gone, or does this represent permanent damage? But every week there's more information as we get better in diagnostics that this infection is really a bad actor. The stuff that I can get through it and get over it is not appropriate thinking anymore.
All right, thank you. And Debbie, we also got a lot of questions about when will my ballot be counted when I drop it off. I believe, I just wanted to reiterate, you did say within about 17 days. That's the goal.
No, well, we would love for everyone to vote their ballot as soon as they get it and either drop it in the mail or drop it at one of our our secure ballot drop boxes. Those will be unlocked the same day the ballots get mailed. And we drop our ballots at the Oakland, Maine post office. So a lot of people receive their ballot the next day. So you should expect it that first week of October.
And specifically to counting after election day, how long do you take to count the ballots up to, was it 17 days?
No, 17 days is how long we can receive ballots through the Postal Service after election day. They have to be postmarked on or before election day, but we have 17 more days. The current law before they changed it was 3 days. So if we received a ballot up until Friday, it was still countable. Now they've added an additional 14 days, so it's 17 days till November 20th. Honestly, we get 99% of those vote by mail ballots by Friday. It's a steep curve after that. There may be a couple that trickle in, and they're primarily going to be our military and overseas voters who have their ballots coming from a much further, distance.
Great.
So we don't count. We can start processing ballots, but we can't count them till after 8 o'clock on election night. So, but we can check the signatures, make sure they're valid, pull the ballots out of the envelopes, get them all ready to go. And we can even start putting them through our system, but we can't push the total button until 8 o'clock on election night.
Okay.
The more ballots we get early, the more ballots will be in that first count.
And we received a few questions also related to that. You could drop it off in any drop box regardless of where you live and it will still be counted?
Absolutely.
Okay. Question for Dr. Joseph. Somebody wrote that even with university precautions in place, testing, single dorm room occupancy, et cetera, would you recommend sending a college student to live in the dorms?
Let's go back to the quick answer. It's risk versus consequence. The risk is based on the prevalence at that college campus. And as we have discussed before, some college campuses are screening dormitories by wastewater checking. Some are doing frequent testing of all students. And all of that changes the individual circumstance. And then the consequences, well, definitely not if the college student has an underlying immune problem. But it's such an individual decision that I think the better answer here is to say it really should be evaluated personally. In general, crowds are bad, but there are definitely exceptions where some colleges are fantastic. And I think it's the University of Illinois, University of Syracuse has just come up as being fantastic, providing a safe environment.
Mayor, I think we have, we're a little bit over, but we have time possibly for one more.
Sure.
And this is for Dr. Joseph. A recent report from the CDC said that 94% of patients who have died from COVID-19 had comorbidities. Some people are interpreting this to mean that they died of causes other than COVID-19. How was the cause of death determined?
It's really a good question. This is not new to COVID. It's not different with COVID. The cause of death, or the COD, generally has many factors. Let me give you an example. If an individual has a very severe coronary artery disease and gets a bad case of pneumonia, and that pneumonia caused a heart attack and death, well, it's a judgment call. Was it the pneumonia that caused the death, or was it the underlying heart disease? And that's been an issue in clinical medicine for as long as I have been in it. What we have elected to do is teach doctors to say, if the COVID was a contributing factor, it should be listed. In other words, if you can say to yourself, but for the COVID infection, this person would not have died when he or she did, then it's COVID. And that's only by convention. But if I get COVID and have severe underlying disease, my chances of death are much greater. If I get COVID and don't have underlying disease, my chances of death are much less. But that's how it's addressed today.
Great. Now I'm going to reserve the prerogative of asking a quick question about upcoming Halloween to Dr. Joseph. Two things. Some people have talked about getting these long PVC pipes that are like 6 inches diameter and dropping candy in one side and kids get it at the other end. So they have the social distancing. So the two questions would be, is that okay? And more importantly, if kids collect bags of candy, can they wait 24 hours and is it safe? Parents want to know this stuff, and
Yeah.
grandparents.
Well, I think we've gone, at least in my lifetime, we've gone from accepting unwrapped food products during Halloween. So candy should be wrapped. And the answer is candy. The wrappers of candy is an extremely unlikely way to get COVID. So yes, the candy is safe. I haven't heard about the long PVC pipe, but it's not the candy that's dangerous, at least for COVID. I'll stay away from anything else that can. It's not the candy that's dangerous for COVID. It's the face-to-face contact. So another reason to wear a Halloween mask under your mask.
And keep that social distancing.
That it's a person-to-person disease, not a candy-to-person disease.
Dr. Joseph, thank you for answering questions, but also a great presentation on flying in particular. That was really helpful for a lot of folks who fly and have done so fearfully. Debi Cooper, thank you for the homework you did to prepare and again to inform our residents on how they can vote and how the process works and to confirm that it's well organized and you guys know what you're doing. And thank you very much. Candace, as always, we appreciate you being here every Friday morning. We have this and to update us. You're having to process lots of information all the time. We really appreciate your endurance in this because I know it's got to be taking a toll. All of us appreciate the work you and everybody is doing to keep us safe. Joe Gorton, always managing our city. Thank you very much, sir. Appreciate you being here for us. And of course, Steve, organizing this, putting together a nice presentation on why we're having to go to district elections and also quarterbacking all of our questions. We went a little bit long today, but I think it was well worth it. Good information. And everybody stay safe and enjoy the fresh air we're getting right now. Hope it lasts. Take care, everybody. Thank you.
Bye.